They say you are what you eat, and doctors will tell you what's inside a lot of your favorite foods could be making you sick.
I really have been referring to them as frankenfoods, right? They're food-like substances. They're not really food.
Dr. Shad Mirvasi is the director of integrative medicine at Honor Health. He points out that ultra-processed foods make up about 70% of the average American's diet.
The menu items have many more of these chemical ingredients in the US versus in Europe, for example, for the same item, or a cereal brand, for example. And so the question really arises, why do we need these chemicals, especially if there's a potential for health risk in each of them?
That's a question Arizona Republican Representative Leo Biasiucci is also asking. He just introduced a bill that would forbid 11 ingredients from being served at public schools.
We need to make sure that they're getting the ingredients that are not only safe, but just nutritious.
There's studies to back that all of these are not good for you in multiple different ways. They've been banned in some other countries. A number of them also have been already banned in some states like California. And they have a range of health effects, right? From cancer, some of these dyes are also associated directly, like yellow number 5, with hyperactivity and ADHD in kids.
2 of the additives on Biasiucci's list were recently banned by the FDA. This week, the feds announced what's known as red dye number 3, which gives lots of treats and drinks their bright cherry red color, can no longer be in food. This comes nearly 35 years after it was barred from cosmetics because of potential cancer risk. In this past July, the agency outlawed brominated vegetable oil, citing health safety concerns linked to the fruit flavoring stabilizer.
You can't, dispute this. Like, this is black and white. We know it's toxic.
Biasiucci's proposal would not affect packed lunches and would only apply to school-sponsored meals.
Our school lunch program counts ketchup and French fries as 2 servings of vegetables. And these are processed foods. So there needs to be reform here.
Biasiucci tells me he knows the increased cost of a large-scale change like this is the major hurdle to his bill becoming law. But to him, it's a choice to pay now or pay later with higher childhood obesity and diabetes rates. He hopes to gain the support of RFK Jr. to push this legislation through and use federal dollars to make this shift in Arizona's school lunch program. Reporting live, Michaela Marshall for Arizona's Family.
All right,